Production. He has been just amazing with his work on media coverage. Norman Solomon. Norman, who are you?
A few weeks ago, it was in Texas, but could have been anywhere in this country. I spoke at a community college, and after the presentation, I was approached by a man in his mid-20s. He was in a wheelchair, and he said, people have no idea of the consequences of the lies that are told from Washington and through the news media. He had no legs. It gradually dawned on me that he had come back from Iraq. Abstraction is what wars thrive on. The propaganda, the media spin for war, abstraction, the soft focus, the rhetoric, the platitudes, not the man or woman without legs, not the grieving Iraqi human being, not the grieving American human being. Abstraction is what we are about ending in our political movements. Yeah. Recently, I did what many people in this room, I'm sure, have done. I spent night after night in a hospital room. As someone I love spent her last days of life. And I thought about the courageous fight being fought year after year by the California Nurses Association that is blandly in the politics and media of the day called nurse staffing levels. That's not what it's about. It's about life and death. That's what the union movement, that's what healthcare, not warfare, is about. Not about abstraction. In the fall of 2002, in December of 2002, in January of 2003, as I walked through the streets of Baghdad and I saw children there, and I thought with increasing urgency, will my country bomb you? That is not abstraction either. And today, with the armored vehicles, with the helicopter gunships paid for by U.S. taxpayers, continuing to gun down Iraqi people, to fan the flames of a destructive war, that's not abstraction either. Today, in the emergency rooms of this city and this country, the thousands and thousands of people who are there because they didn't have access to health care earlier on when their problems could have been ameliorated, when their problems could have been nipped in the bud, that human suffering, the deaths that result, that's not abstraction either. Healthcare, not warfare, is central to our movement. 40 years ago, as a teenager, I went to the Capitol Mall in Washington and saw the end of Resurrection City, when a White House fixated on war literally and figuratively bulldozed the Poor People's Campaign. 4 decades later, today, nationwide, we have $2 billion being spent on the U.S. military. You notice I didn't say defense, I said U.S. military, $2 billion spent. And meanwhile, we're being told in this state that $567 million has to be cut from the Medi-Cal budget so there can be a reduction in 10% of the reimbursement rates for Medi-Cal, when anybody who knows anything about health care in this state knows the reimbursement rates are already paltry. They are death sentences for people in California. That is unacceptable. This afternoon I did a little back-of-the-envelope calculation. What does $567 million cost out to for the war on Iraq out of the U.S. Treasury? 30 hours. 30 hours of war in Iraq. I feel very fortunate to be a co-chair of the National Healthcare, Not Warfare campaign with John Conyers, with Donna Smith, who you've seen in Sicko, with Marilyn Clements, a longtime fighter for single-payer health care, with Healthcare Now organization. And we know here we've had tremendous leadership. So many people at the podium here, at the dais, in the room, in the state legislature, at the grassroots, supporting and fighting for the visionary bill put forward by Sheila Kuehl. And the Healthcare Not Warfare campaign is another stream into the river of movement for John Conyers' bill, H.R. 676, for a national single-payer healthcare system at last. I had the enormous pleasure a few weeks ago of going to Sacramento as part of the growing Healthcare Not Warfare campaign. And I stood next to Bill Durston, who's going to run in November, and we believe the truth in numbers. But you know, it's not only personal. I know that many people in this room feel that way as well. We take the world personally, and we intend to change the world, to learn from history and change it. I was fortunate enough to be elected as a delegate to the Democratic Party State Central Committee, even though 14 months ago at the Caucus in my AD, I had a prior commitment. I was in Memphis, Tennessee, to speak at the Free Press Conference. And on the day that we all chose our AD representatives in this state, for the first time in my life, I went across town to Memphis and turned the corner and burst into tears, because there at the Lorraine Hotel was the location that 40 years ago a bullet traveled across the street and took Martin Luther King Jr. from us in his life, but not his spirit. He spoke about the madness of militarism. He insisted that we would not be passive in the face of that madness. Today we refuse to be passive. We're going to organize. We're going to change history.